I'm joined by Dr. Eric Ragazzino, who's a psychiatrist at Phoebe Behavioral Health, to talk about our mental health. So when we talk about mental health conditions, what does that really mean? What all does that encompass?
So at its core, mental health conditions are situations rooted in problematic thoughts, emotions, behaviors that are so significant they lead to impairment in a person's ability to function effectively in key areas of their life, such as work, relationships with friends or family, and school, society in general. They can emerge from triggers which most of us might see as clear. For example, a trauma can lead to mental health problems. They can emerge seemingly out of nowhere, where a person has these episodes that are significantly different from their baseline. They can emerge in the young, they can emerge in the elderly.
We've come a long way in the treatment of mental health. Are some people still hesitant to seek out help?
For many people, they might be reluctant to reach out to help because their self-esteem is so low that they perhaps don't believe they deserve help. Or their self-esteem is so rooted in the judgment and opinions of others that they wouldn't want to face that stigma. Often people with psychiatric illness feel like they're different, they're special. What's going on with them can't be understood by others, and I suspect they simply don't believe the treatment can help them. But the fact of the matter is, there are many people from a wide range of backgrounds that are benefiting greatly from psychiatric treatment.
And taking care of our mental health is a vital part of our overall health, right?
If we agree we have a mind, and so mental health is the health of our mind, and we agree that we have a body, and so physical health is the health of our body, I would ask you to consider where then the mind ends and the body begins. I think that's a difficult question to answer. And perhaps the reason that border is difficult to find is that effectively there is no difference. If that's a little too philosophical for your liking, consider physical ailments, okay? If you go to any hospital in the country, it's going to be dominated by illnesses like COPD, complications from type 2 diabetes, complications from substance problems. And these conditions are to a large degree rooted in thoughts, choices, and behaviors that the patient is carrying out. So certainly you can see how your mind impacts your physical health. I think what people don't know as much about is how it goes the other direction. There are very, very many studies that suggest that exercise, for example, can be every bit as beneficial as medication in certain cases in the treatment of depression. So caring for the body also can ultimately go a long way to caring for the mind. And it may well be that that's because the two aren't really as different as we think.
Treat a lot of children here at Phoebe Behavioral Health. Are mental health issues very common in kids?
Certainly. And it's tricky because kids, again, we're talking thoughts, emotions, behaviors. For kids, that constellation of features is in the development phase, right? So kids are more prone to behavioral issues anyway, and their thinking can sometimes be still developing. But yeah, we certainly see a lot of issues that can arise in children.
So we're in a group therapy area here at Phoebe Behavioral Health. Why is that important, and what range of services are available here?
Therapy is a great treatment option. You forego the potential side effects of medication. Depending on your diagnosis, it may in fact be the first line treatment anyway. And in terms of group, one of the things that we find is sometimes a person, let's take a older person who's maybe recently lost their spouse, and a lot of their mood symptoms may be rooted in loneliness.
Sure.
So sometimes just having that camaraderie of the group adds a little extra benefit. Sometimes a person's illness may be rooted in a social anxiety. Okay, so sometimes having a group, a safe setting to start to expose them to social situations so that they can become more resilient to social situations, there can be a lot of benefit for that.
What should we do if we have a loved one that we're concerned about? We're worried about their mental health.
Yeah, so again, getting back to you're seeing yourself or a loved one, and it seems to be there's some type of thought pattern or some type of emotional issue or some type of behavioral problem that is causing some dysfunction in this person's life, right? Certainly, I think to the extent they may have some fears or concerns about judgment or stigma, I think reaching out to them and saying that you're noticing something and you thought you wanted to talk to them about it and thought it might be worth them seeking treatment could allay some of those concerns rooted in judgment or stigma. Obviously, to the extent that someone seems to be an imminent threat to themselves or to others, I would contact emergency services quickly.
Dr. Ragazzino, thanks for joining us today and sharing your expertise.